Good morning. In this educational provision of cefotaxime in the treatment of pneumonia, the choice of delivery is that of a PowerPoint presentation in the classroom for the students in the fourth semester of Adult Critical Care for the UTMB School of Nursing. With the utilization of PowerPoint presentations in distance education, the influence of program delivery on the overall program outcome, the use of technology, and the learning quality that results must be considered in the course faculty evaluation. The evaluation of the knowledge attained from this lecture presentation will be that of a graded patient education project provided at the end of the presentation. Each student will then be provided the opportunity to interact with a mock patient in the assessment and teaching process on the disease pneumonia, including the pharmacological therapies administered in the simulation lab at the end of the lecture. An anonymous evaluation of the lecture will be provided to each student with the completion of this course. Contents are stated here below. Here are the goals. To develop a knowledge and understanding of the antibiotic cefotaxime as it is utilized in the treatment of pneumonia, to recognize the pharmacological process of cefotaxime with a complete understanding of the mechanism of action in the antibiotic therapy, and to develop a knowledge of the antibiotic treatments in the care of pneumonia. An overview evaluation of a course and faculty is an essential component of the improving program outcomes. Several variables contribute to the success of an academic program, including the qualifications of students admitted, definition and implementation of progression policies, quality of the curriculum as well as quality of the instruction, and evaluation methods used to determine the students' knowledge, skills, and abilities, and the student preparation for employment and employer satisfaction. With the overall goal of this learning activity being that the students comprehend the knowledge provided, these continuous cyclic evaluations are a major component of its success. Adequately comprehending the disease process and its origins, as well as the medical treatment options, will enable the learner to utilize the gained knowledge in the treatment of the patient with the best possible outcomes in the healthcare setting. The objectives of this lecture are that after completing this lesson, the students will be able to explain the mechanism of action of cefotaxime in the treatment, be able to recognize the pharmacokinetics of the antibiotic cefotaxime, as well as utilize the knowledge of the medication and its treatment of bacterial infections, that in the clinical setting, and that the students will be able to critically evaluate the medical interventions of the administration of antibiotic therapy with the ability to discuss monitoring measures of the client while receiving therapies. As nursing students must learn and utilize a variety of mental processes, including critical thinking, reasoning, and judgments, along with the creativity and solution building and the application of applying in the healthcare setting, the provision of the crucial knowledge base is imperative in its best capacity. The instruction provided will be taught here in this lecture format with you today, with the opportunity of a clinical simulation setting in which discussions will be encouraged about the medication and other treatment therapies. At the end of this lecture, you students will be able to be given an assigned project creating a PowerPoint presentation for the care of the client utilizing the medication cefotaxime. Additional credit will be awarded to those students who share additional and maybe non-FDA regulated uses for cefotaxime and in their presentations. The learning outcomes from this lecture are that the students will be able to demonstrate their knowledge of the treatment with cefotaxime by simulations with mock patients and the provision of the education to the client about the medication at the end of this lecture. The students will be able to verbalize the treatment measures and the rationale of choice and the antibiotic therapy for the treatment of bacterial respiratory infections by analyzing the mechanism of action of the medication cefotaxime, and that the students will be able to illustrate the pathological process of the disease as well as the treatment of antibiotics with the ability to demonstrate the learned knowledge in PowerPoint presentation at the end of this course. There are multiple categorizations of pneumonia based on how and where it is acquired, including community-acquired, healthcare-associated, also described as hospital-acquired, and ventilator-associated pneumonia. Those most directly affected by pneumonia are those who are elderly, alcoholics, those who smoke, and those who have nutritional deficits. Here we will discuss the pharmacological treatment for bacterial pneumonia. Pneumonia is an infection of the lower respiratory tract caused by viruses, fungi, protozoa, or parasites. This virus destroys ciliated epithelial cells and invades the goblet cells and bronchial mucus glands. This then results to sloughing of destroyed bronchial mucus glands and sloughing of destroyed bronchial epithelium that impairs mucus clearance by cilia. This then leads to the consolidation of the alveoli, leading to pus formation. There are two different types of pneumonia, including viral and bacterial. For antibiotics to work, they must accomplish three tasks. First, the antibiotic must bind to its target site, penetrating the outer membrane and avoid being pumped out of the membrane, and remain intact as a molecule. Second, it must bind and occupy multiple binding sites. And third, it must remain long enough to allow time for the metabolic process of the bacteria to be inhibited. The definition of cefotaxime is that it's an antibiotic that is utilized in the treatment of bacterial infections, including respiratory infections such as pneumonia. The classification is as a B-lactam antibiotic in the third generation class of cephalosporins. Cefotaxime is active against numerous gram-positive and negative bacteria, including several with resistance to B-lactam classics, such as penicillin. The mechanism of action, let's discuss that. The cefotaxime is a bactericidal agent that acts by inhibiting the bacterial wall synthesis. It is resistant to the potential action of enzymes, such as beta-lactamase enzyme, as a result of its chemical structural modifications. This inhibits the final transpeptidation step of the peptidoglycan synthesis in bacterial cell walls, thus inhibiting cell wall biosynthesis. Bacteria eventually lyse due to ongoing activity of cell wall autolytic enzymes in the absence of cell wall assembly. Recognizing the interactions with other medications, those clients who should not be administered to, as well as the possible side effects, will enable the nurse clinician, as well as the medical provider, to practice in a safe method for the care of the client with the prompt ability to intervene as appropriate should the opportunity to arise. So what do we look for? Cefotaxime is contraindicated in any patients that have known hypersensitivity to cefotaxime or other cephalosporins, and drug interactions that are most important here are that of amikacin, NSAIDs, or warfarin. Cefotaxime should be avoided, for the administration in neonates as well as the geriatric population that are being treated with calcium. As liver concerns are also present, those patients with any hepatic disorders should use this medication cautiously. The most common adverse effects of cefotaxime are rash, pruritus, fever, diarrhea, nausea or vomiting, colitis or pain, inflammation at the site of injection or infusion. Drug treatment. Cefotaxime necessitates 2 to 3 doses daily. This medication is administered intravenously or intramuscularly and is metabolized by the liver and excreted in the urine. Expected outcomes of this medication is that the bacterial cells are unable to multiply by the breaking down of the cell's walls, allowing the immune response of phagocytosis to occur, essentially destroying bacterial cells. An important note to remember is that calcium infusions should not be given to a patient within 48 hours of ceftriaxone infusions. In rare occurrences, this medication can cause seizures. Recognizing the advanced practitioner monitoring parameters allows for the nursing clinician the opportunity to anticipate orders as well as plan for the care of their client. Assessing the results of culture sensitivity tests and patient's allergy history prior to therapy, obtain CBC and renal function tests periodically with prolonged therapy, monitor for signs of anaphylaxis during first dose, and assess for effectiveness of treatment, and test for C. difficile if the patient develops diarrhea. These are all assessment progresses for the advanced practitioner monitoring. The nursing assessment and monitoring is to check ordered labs and report abnormalities. Monitor closely for signs of hypersensitivity, including shortness of breath, dyspnea, chest pain, or complaints of difficulty swallowing or throat tightness, and always vital sign changes. Monitor for severe or bloody diarrhea and send a specimen to the lab for C. difficile should those changes occur. Monitor for improvement with infection as well. A key takeaway here is that we as nursing clinicians are the last chain in the care of the client. Appropriate monitoring of the client ensures that the safety of our client while receiving treatments is had. In conclusion, the appropriate therapy choice in the treatment of disease such as pneumonia requires testing, assessment, and evaluation of possible interactions and needs for the client. How a medication works in the body enables the natural defense system to attack and protect its host. We as care providers must possess that knowledge and understanding of medications that we treat our clients with and the complete comprehension of that disease process in which we are treating. So questions. In the pursuit of the appropriate treatment of pneumonia, what pathological variances should we consider in the selection of medications? How precisely does cefotaxime effectively treat pneumonia? And what educational points should be provided to the patient when administering this education? Here's your works cited. Now let's get started.